let's go on to the next case. So this one's a little bit of a story. This was a young guy. I think he was 13 or 14 years old. So he'd come to ultrasound, and he was saying that he has now got a pain on the outside of his leg. And this is new. And I asked him, look, are you very active these days? And he was like, yeah, I've been pretty active. I've been getting into, it was Muay Thai. So he was doing a lot of kicking and things like that. So his parents felt as though maybe he got injured or something along those lines. And so I did the ultrasound, and this is what it genuinely looked like. So are people really going for exorcism, by the way? That was a bit of a joke. So enchondroma, exorcism, exostosis, and fibrous dysplasia. So at this point, I pretty much knew what I thought it could be, but it's kind of an outpouching thing, and I'll show you. So look, this is sort of this is the outside of his leg, right? And this is his sort of distal femur. And it felt like there was kind of outpouching like this and this sort of irregular contour to this weird thing over here. And maybe a little bit of fluid there, and it's sort of causing a bit of mass effect onto everything outside as well. And so you think, okay, well, what could that be, right? And this is the first, and he's grown up his whole life and never even noticed it. So we did the X-ray, and exactly what we thought it could be. So what people said. So for those that thought it was an exorcism, it's not an exorcism. Thankfully, he was fine. He was acting completely well. I didn't need anyone to come in and do an exorcism on him. And it's not an enchondroma. There's not much in the way. It's not kind of enchondromas won't poke out like that. And generally speak, find them in the fingers, the phalanges. And fibrous dysplasia would be intermedullary and have a very sort of ground glass appearance, right? But this is an outpouching and is pointing away from the joint, right? It's pointing away from the joint, right? So therefore, this would be in keeping with an exostosis, right, or an osteochondroma. And so what can happen is that, like he was saying, he has a bit of pain. And so that is actually something to worry about. So if someone has pain around getting to puberty around that time, then you should start worrying that there could be something else going on. Even if they suddenly ended up having pain, that is one of the things that you need to be investigating a little bit further. So this person would end up probably need to get an MRI scan. They would have to look for, and you can do this on ultrasound as well, look for a cartilaginous cap, and that's like a little hat, just so like you get a mushroom. You got a little mushroom like this. Hang on, let's try and draw it. The results are there. So yeah, most people went for an enchondroma. Okay, well, not most people. I know most people went for exostosis, but enchondroma, I think maybe you just saw the ease and went for that. So you go like this, and you got the kind of little poking out like that, and then you've got the sort of cartilaginous cap that sits on top of it, and you've got to sort of measure like how thick that is, and if that's more than 1.5 centimeters, then again you've got to start worrying there could be something more to this. It could be having like a malignant transformation. I suspect in this particular child, this is probably going to be benign. Still is going to be benign, but due to the recent activity, I probably got, you get something called iliotibial band syndrome. So he's probably got an iliotibial band that's going along like this, and it's all getting kind of hitting there, causing a little irritation. And I mean, I don't actually know what they're going to do. I'll try and follow up, but I wouldn't be surprised if they try to alleviate some of the symptoms by trying to shave that off or something. But that was quite an interesting case, something from the wild, and from someone that had no idea that had an enchondroma, exostosis. I'm saying enchondroma now, aren't I?